Hi guys, welcome to this recall session. So PrepLadder is launching Rapid Revision 6.0 on 16th of August, where we are going to introduce the English video lectures. And it will include 260 plus hours of video lectures. There will be 2,500 high-yield MCQs, concise notes. There will be quick revision with the help of these concise notes. So let's start the discussion, guys. First, identify the stage of disease in the image. Clear? So there was one question in the image. Can anybody tell me what was that particular image? Guys, what was that image? Okay. Now see the second one. There was grade of ulcer. So what kind of ulcer was there? Anybody on a journey? What was that ulcer? Whose grade was asked? Someone, someone was telling me that it was grade 4 ulcer. Okay. So meanwhile, if you have the image, please share it in the chat box. We will discuss that. Right. Now, can you tell me what's the answer of this question? Yes. Sudeep Saha, Akshat Kharat. Okay, that was bedsore image, right? Dr. Raman, it was bedsore image, right? So bedsore, okay. So it was image of bedsore. In that bedsore image, tell me the muscle or bone was visible or not? Yes, the bone was visible. What was the location of that bedsore? Location of that bedsore, usually it is in the sacrum. Yes, okay, bone was there. So obviously it is stage 4. If bone is visible, bone is seen, it is stage 4. Guys, so it is pressure sore, bed sore, or ulcer. Bed sore near sacrum, right? In which the bone was visible. So, guys, if the bone is visible, obviously it is stage 4. This is stage 4, right? Bone was clearly visible. So, you know that similar question was asked previously also. So, it is bed sore, stage 4. Okay, next. There was another question related to grade. Anybody remembers that? What was the question related to grade? Sudeep, Akshat, Raman? What was the question related to grade? Okay, there was one question related to water lily sign. Yes, there was water lily sign, floating membrane or undulating membrane. Maybe clever abscess was there. One student was telling me that water lily sign was asked. It was water lily sign. Clear? Maybe clever abscess was asked it or not. Maybe clever abscess was asked or not. Okay, Gharbi stage. So Gharbi stage, obviously water lily sign is the Gharbi stage 2. Water lily sign, that is Gharbi stage 2. Clear? So water lily sign is the Gharbi stage 2. Okay. Next. Let's see. 26-year-old woman presented to OPD with distended neck veins, right? Difficulty in breathing, and patient was diagnosed with myasthenia gravis. Radiological imaging revealed following finding. So what was that radiological picture? Anybody remembers? See, guys, there is distended neck veins and patient is having myasthenia gravis. You know that myasthenia gravis, it is related to thymoma, right? And thymoma, it is mediastinal tumor. So it might compress what? It might compress superior vena cava. That's why patient is having distended neck veins. What was the question exactly? Obviously, the correct answer is thymoma. What was the question exactly? Okay, yes. So it's anterior mediastinal mass. Obviously, it is going to compress superior vena cava. So there is superior vena cava syndrome. Because of that compression, you're going to notice the distended neck veins. What was the image? What was the radiological image? Anybody remembers? Yes, Prasanna, Dr. Raman. Okay. So obviously, correct answer is thymoma, right? So we are looking for that image. Okay. So Santosh wants to say that, sir, there was anterior mediastinal mass in CT. Okay, that's great. There was anterior mediastinal mass in CT. In CT, there is anterior mediastinal mass. So obviously it is thymoma. Anterior mediastinal mass association with myasthenia gravis. Patient is having distended neck veins, difficulty in breathing. Obviously, it is what? It is thymoma. Clear, guys? So correct answer is A, that's thymoma. Right? Next, young patient presented to OPD with recurrent colicky abdominal pain on urine examination showed following figure and RBCs. What's the diagnosis? One student was telling me that, sir, hexagonal crystal was, guys, it was hexagonal crystal. There was hexagonal crystal in the image. We are discussing all the questions. Okay, benzene ring, both shift 1 as well as shift 2, guys. So yes, it was benzene ring or hexagonal crystal. So guys, you know that this benzene shaped crystal or hexagonal crystals, these are seen in cystine stone. Clear, guys? So benzene shaped crystal or crystal, it is seen in cyst. Clear? So most, can you tell me what kind of in oxalate stone, what kind of crystal is seen? So in oxalate stone, you know, in oxalate, calcium oxalate, there is envelope shaped crystal. Clear, guys? So there is envelope shaped crystal in calcium oxalate. And calcium oxalate monohydrate, in calcium oxalate monohydrate, dumbbell shaped crystals are seen. Clear? Okay. Dr. Medico Plus wants to ask that, sir, bladder stone question with photo of calcium phosphate. What? Bladder stone. There is bladder stone question with photo of calcium phosphate. Bladder stone question with calcium phosphate. Okay. So here, guys, the answer is cystine stone, right? Easiest question, a patient underwent gastrectomy. Which vitamin replacement is required? So guys, see, whenever more than 50% of stomach is removed, what happens? There is decreased intrinsic factor. And because of decreased intrinsic factor, obviously what will happen? There is decreased or impaired absorption of B12. And because of the patient will develop megaloblastic anemia. So we have to give lifelong parenteral supplementation. So obviously what's the correct answer? B12. What is the correct answer here, guys? B12. There was X-ray of bladder stone and the option was calcium phosphate. Okay. In bladder stone, what is the most common bladder stone? It is secondary. And guys, it is followed by stone, phosphate stone, calcium, magnesium, ammonium phosphate stone. Okay. So B12 is the correct answer here. Next, identify the disease. Can anybody tell me what was the question? What kind of disease were there? What was the image? Renal cyst, renal tumor, renal polycystic, means polycystic kidney disease or kidney disease. Guys, what was the question related to these options? Okay, it was Romberg classification. There was one question related to Romberg classification. So question was related to Romberg classification. And there were multiple cysts on CT in abdomen. Clear? In which organ? Jomo, in which organ there were multiple cysts? Multiple cysts in which organ on CT? If there are multiple cysts, in the kidney, you know, polycystic kidney disease, it is associated with polycystic liver disease. There might be cyst in pancreas, cyst in ovary. Okay, multiple cyst on the left kidney. Only one kidney, only left kidney, or it was in the right kidney also. So if only one kidney, this is renal cyst. And if bilateral kidneys were involved, it is polycystic kidney disease. Only one. So obviously the correct answer is renal cyst, but it depends what kind of cyst was there. It was simple or complex, right? So on the basis of features of the cyst, yes, we have to look for, and then we are going to decide whether it's benign tumor or it's malignant tumor. or it's only cyst. Only one cyst is there. So chances are patient is having renal cyst. Okay. Yes, inosculation, imbibition, inosculation question. Okay, 3 cysts. Okay, 3 cysts. Right. Next, TTFI. Clear? So TTF1, there's a tumor marker for adenocarcinoma. So it's a marker for adenocarcinoma lung, already. Clear? So it's a marker for adenocarcinoma. This is a repeat question. Next, guys, see here. 12 years old child presented to OPD with complaint of pain in scrotum and there is history of trauma 6 years back. On exploration, surgically this finding, what is the diagnosis? So can anybody tell me what was the finding? What was the color of testis? It was bluish, there was torsion, something like that. It was bluish, there was some torsion. Large black mass was given. Okay, so the whole testis was black or only appendage was blue or black. If the large mass is blue or black, dark bluish, it means it's the testicular torsion. And if only one part over the upper pole, then it is testis, then it is the torsion of testicular appendages. Guys, so if large mass is there, obviously what's the correct answer? In that case, the correct answer is testicular torsion. And if it's bluish black, yes, okay, it was larger than a tennis ball. So guys, it's testicular torsion. It's testicular torsion. And typical feature, complaint of pain in scrotum, the torsion age is around 12. Clear? So correct answer is testicular torsion. Next. What is the management of radiological finding? Okay. Somebody told me that, sir, there was image of ureteroscopy. Or someone told me that, sir, there was urethral valve. Yes, one student was telling me that, sir, there was urethral valve. So guys, if there is urethral valve, usually it's the posterior urethral valve. Prachi, why not appendages? Because in appendages, only little part is bluish. There is blue dot sign, only little part, not the whole testis. So whole testis is not gangrenous, only one part over the upper pole. Clear? Testicular appendages. So if only little part is involved over the upper pole, that is involvement of appendages. If the whole testis is involved, obviously it's testicular torsion. So urethral valve, and how we manage urethral valve? Obviously, we go for yes, endoscopic fulguration. So it is not internal urethrotomy, it is not dilatation, it is not stenting. We go for endoscopic fulguration. Yes. So correct answer, guys, actually, it is endoscopic fulguration. We go for endoscopic fulguration. Right? We go for endoscopic fulguration of valve. Okay, Dr. Santosh, Dr. Sudeep, right? Next question. 40 years old female presented to 5 into 6 centimeter irregular mass in right breast and histopathological examination revealed this image. What is the diagnosis? Guys, tell me. If there is urethral stricture, guys, we will go for what? It depends what is the location. Phyllodes tumor. Okay, so there was image of phyllodes tumor. Large mass. Okay, there was histopathological image. Yes, I remember the question. So there was histopathological examination suggestive of phyllodes tumor. This was question related to phyllodes. Phyllodes tumor. It is having leaf-like appearance on cut section. Phyllodes tumor. It is having dual origin arising from mammary epithelium as well as connective tissue. So correct answer for this question was phyllodes. Clear? It was phyllodes. Okay, next. What is the ideal pressure for pressure dressing? This was the question, or the question was related to negative pressure wound therapy. Guys, what was the question? It was related to pressure dressing or vacuum assisted closure, or it was related to negative pressure wound therapy. Okay, vacuum dressing. Okay, vacuum assisted closure. So guys, you know that in vacuum assisted closure or in negative pressure wound therapy, vacuum assisted closure or negative pressure wound therapy, how much is the pressure? We apply vacuum, so minus 125 mmHg. The pressure is applied, how much? The pressure applied, it's minus 125 mmHg. Clear? So vacuum assisted closure, It is minus 125 mmHg. So the pressure is minus 125 mmHg. Okay. Next question. Endoscopic image show following finding. What's the diagnosis? One student was telling me that, sir, there was image of in esophageal varices. Guys, what was the question? Okay, junior surgeon, that was correct answer is minus 125 mmHg. It's negative pressure wound therapy. Okay. So it's esophageal varices. There was one image-based question related to esophageal varices. Esophageal varices. Okay. Sudeep Saha wants to say that, sir, dilated tortuous vein in endoscopy. Yes, that dilated tortuous vein in endoscopy, that is esophageal varices. Clear? So there was dilated tortuous vein. These are collaterals actually. So dilated tortuous vein, these are actually collaterals. These are actually collaterals. Collaterals, right? Right. So this is esophageal varices, right? Next, which of these is an indication for giving adjuvant radiotherapy? What adjuvant radiotherapy in oral malignancy after resection and MRND? So guys, what is the indication of radiotherapy when large tumor is there, high grade is there, involvement of bone, involvement of nerve, involvement of cervical lymph node, or positive margin is there? Clear? So T3 tumor, it's not an indication. Close margin, not an indication. Multiple lymph node metastasis. Yes, that is an indication. And extranodal extension. So exactly which organ or which structure is involved, that's important. If there is involvement of bone, involvement of cervical lymph node, involvement of nerve, large tumor, high grade tumor. Okay. So extranodal extension, it depends that which organ is involved. Okay, one question was there related to esophageal coin. So it was related to esophageal coin on chest X-ray. Yes, esophageal coin. Coin in esophagus. Very good. So most probably here, multiple lymph node metastasis. See, both of these are correct. So if it is clearly mentioned that cervical lymph nodes are involved, that is also an indication. Clear? So depends on the exact language. What instrument is used to insert this tube? Guys, it was ureteroscopy, I think. What is the most common complication of TPN? There was one question. TPN most common complication. Clear? Guys, what were the options in TPN? Okay. So if it was ureteroscopy, if it is ureteroscopy, to perform ureteroscopy, first we have to go for cystoscopy. So if we had to perform ureteroscopy, first we have to go for cystoscopy. So first cystoscopy is done. Then you perform the ureteroscopy. Clear? So first cystoscopy. Okay, rebound hypoglycemia. There was hyperglycemia. Yes. Hypoglycemia, hyperglycemia. What about the other options? TPN, rebound hypoglycemia, hypertriglyceridemia. Okay, there was image also, right? So there was hypoglycemia, hypoglycemia, hyperglycemia, hyperglycemia, rebound hypoglycemia. There was rebound hypoglycemia, and what else? Rebound hypoglycemia and hypertriglyceridemia. Hypertriglyceridemia. Okay. 110 to 130, that is also fine. That is also fine, Namrata. Okay. Next. See, age, typical age, 4 weeks old child, history of vomiting, undergoes ultrasound image. Which of the following is the diagnosis? So anybody remembers what was that image? What was the finding? For DJ stent insertion, we use ureteroscope. So guys, here, if you see the patient picture, okay, compressed pyloric area. Even if it is 6 weeks, that's fine. So obviously the correct answer is hypertrophic pyloric stenosis. So it is congenital hypertrophic pyloric stenosis. That's the correct answer. If patient is having vomiting, there is compressed pyloric area. Clear? Next, which of the following is correct regarding the patient who presented with following as shown in image? Earlier, mass was reducible, but now it has become irreducible. Somebody was telling me that, sir, it is a case of umbilical hernia. It's a case of umbilical hernia. Umbilical hernia. Okay, there was one question related to endotracheal tube position with photo. Endotracheal tube position. Okay, there was discharge coming out, right? So umbilical hernia with discharge coming out, it might be strangulated. If it is strangulated, obviously mesh is contraindicated. So mesh is contraindicated if it's strangulated. So in that case, we just go for excision, right? And whenever it is strangulated, conservative management should not be done. So guys, use of mesh, it is contraindicated in strangulation and conservative management should not be done. Clear? So correct answer is umbilical excision, if this was the question. Next, what type used to cover this post-burn wound? Yes, so it was split thickness skin grafting. Usually full thickness skin grafting, it is done where cosmetic areas are there and patient is having small full thickness defect. Especially in burn patient, we are going for STSG, that is split thickness skin grafting. So it was split thickness skin grafting. Clear? Next, a patient presented to OPD with following finding on radiological imaging. Liver metastasis is seen. Guys, apart from liver metastasis, what was the other finding? Yes, one person was telling me that it was what kind of tumor? Let me check. Yes, Dr. Santosh, right-sided ulcerated breast lesion. Okay, there was right-sided ulcerated breast lesion. It was right-sided ulcerated breast lesion. So there was right-sided ulcerated breast lesion. Breast lesion with liver metastasis. With liver metastasis. Clear? So guys, whenever there is metastasis, obviously it's the stage 4. And if it is stage 4, what you have to do? First, you have to go for chemotherapy. Clear? So what? First, we have to downstage the tumor. So obviously, we will go for neoadjuvant chemotherapy. And after that, when the tumor is downstage, then only we will go for surgery. Clear? So it is fourth option. Yes. It is neoadjuvant chemotherapy followed by surgery. Okay, Santosh. So this is the correct answer. First, you have to downstage the tumor since patient is having liver metastasis. Yes, one image was there of Phyllodes tumor. Next, Jeep driver. Guys, it's Jeep driver presented with pain in gluteal region along with swelling. What is the diagnosis? Can you tell me what is the name of Jeep's disease? It's the pilonidal sinus. So pilonidal sinus, which is more common in Jeep drivers of army. Pilonidal sinus, more common in Jeep drivers of army. So most probably it is pilonidal sinus. Okay. Somebody is saying that, sir, Jeep driver was not mentioned. Okay. Some student was telling me that, sir, there was a question and in which there was external opening around the anus. So actually it was related to fistula in ano. Fistula in ano. Guys, there was external opening around anal, around perianal region. Okay, so Jeep was not there. Okay, pus was coming out. Pus coming out. So most probably it is fistula in ano. From external opening, pus is coming out. So it is fistula in ano. Yes, most probably, guys, it's fistula in ano if pus is coming out. Clear? So if there is external opening, yes, it was fistula in ano. Next, surgery was performed. Image is given below. What's the name of this procedure? What was that image, guys? Can you tell me? What was that image? Most probably it was related to ortho. What was that image? What kind of amputation image was there? Tibia fibula cut section. Okay, so related to ortho, tibia and fibula. Okay, it will be discussed in ortho. Okay, next, a child presented to OPD with following finding When will be the first repair done? Some student was telling me that there was cleft lip and cleft palate both. The patient was having both cleft lip plus cleft palate. So let me tell you the logic, guys. If there is only cleft lip, the repair can be done at 6 months. If there is cleft of lip with soft palate, it can be done at a bit earlier, 4 to 5 months. Cleft lip and palate both were there. So if both were there, the hard palate is involved 18 months. If hard palate is also involved, it is 18 months. If there is cleft lip plus soft palate, then it is 6 months. 6 months if it is cleft lip plus soft palate, and if hard palate is also involved, it is 18 months. Somebody was telling me that, sir, 18 months was there in the option. See, guys, if it is soft palate only, mark 6 months. If it's hard palate, then it's 18 months. So yes, somebody is telling me that yes, sir, there was 18 months. So if it depends on the image. If there is cleft of hard palate, then 18 months, soft palate 6 months. Right? Next. Child with following radiological image presented to OPD, what will be the management? So this was, yes, I think this was the image in which there was posterior urethral valve. There was posterior urethral valve. And guys, here we are going to perform what? We are going to perform endoscopic fulguration or ablation. So this is posterior urethral valve, and we are going to perform endoscopic fulguration or endoscopic ablation. Clear? So it's endoscopic ablation or endoscopic fulguration. Okay. Next. Intraoperative image of congenital hernia repair structure. Mark identified structure. Hernia repair. What was the structure marked? Santosh Krishna, Anwar. What was that question? J. Bluish. Okay. So guys, in relation to hernia, see, there will be inferior epigastric vessels. In relation to hernia, inferior epigastric vessels will be there. Clear? If it is related to ring, direct or indirect. Okay, so chances are that D will be correct answer, but it depends on the image. Okay, next. How to take biopsy in the following? What was the question? What was the problem in the patient? Yes, what was the problem in the patient? How to take biopsy in the following? What was the diagnosis, guys? Anybody remembers? What was the diagnosis? How to take biopsy in the following? Okay, Amrit wants to say that, sir, there was spermatic cord. And obviously, if it's spermatic cord, then there is testicular vein. If they showed the image of spermatic cord, then it is testicular vein. Yes, it's testicular vein if it's spermatic cord. And if they showed the laparoscopic image, yes, near deep ring and the triangle of Hazelbach, then it is inferior epigastric vessels. But if it is spermatic cord, obviously, it was testicular vein. Okay. Squamous cell carcinoma of lower lip. There was squamous cell carcinoma of lower lip. Of lower lip. Here, we are going to take edge biopsy. Guys, what kind of biopsy is taken? Edge. So it is edge biopsy, not the incisional, not the excisional. It is superficial from border with normal tissue. Why? Because in oral cavity malignancy, if you're going to take biopsy from the center, there is necrosis. So what kind of biopsy? It's taken from superficially from border with normal tissue. That is edge. So it is edge biopsy. Clear? So this is edge biopsy. Okay, guys, edge biopsy. So correct answer is C. Next. Patient was brought to emergency with history of fall and injury to head. Radiological finding revealed what's the diagnosis? Somebody was telling me that, sir, it was SDH. What was the image, guys? It was SDH. Okay. Somebody says that no. membrane. So it depends. If this concavo-convex blood is between dura and arachnoid, obviously, if it is between dura and arachnoid, it is SDH. Okay, so it depends on the image. Somebody says that, sir, it was SDH or SH. Depends on the image. How does graft get nutrition on day 3? Guys, see, there are 3 phases of grafting. One is imbibition. Second is inosculation. And third is revascularization. Imbibition, inosculation, and revascularization. Clear? So usually for the first 72 hours, imbibition occurs. 4th to 5th day, inosculation occurs. And more than 5 days, revascularization. Clear? So obviously it is imbibition. If on day 3 is asked, up to 72 hours, it's imbibition. 4th, 5th day, inosculation. And after 5 days, revascularization, guys. So what is the correct answer here? Imbibition. Clear? It's imbibition. Next, what type of ulcer is this? What kind of ulcer? Somebody was telling me that, sir, it was arterial ulcer. There was an image of arterial ulcer. Can you tell me the location? What was the location of that arterial ulcer? Above medial malleolus. Guys, if it's above medial malleolus, then typically it is varicose ulcer. It is in the gatus region, varicose ulcer. If it is above medial malleolus, and if it is near shin of tibia or at the pressure points, then it is arterial ulcer. Okay, yes, okay, somebody is saying that, yes, it was middle side gatus area or gatus region. So if it is gatus region, guys, it is venous ulcer. If it is gatus region, then it is venous ulcer. Shin of tibia or pressure points where there are high chances of ischemia, then there is arterial ulcer. And whenever arterial ulcer is mentioned, you're going to see the signs of ischemia like brittle nails, like loss of hair, shiny skin, thin shiny skin, and what? Brittle nails, all these things will be there. Okay, sloping edge, yes. So correct answer, it is venous ulcer. Next, patient presented to OPD with recurrent diarrhea, abdominal pain, foul smelling stool, colonoscopy revealed following finding. There were whitish deposits like pseudomembranes. So obviously, if it's like that, it is pseudomembranous colitis. Recurrent diarrhea is not there in FAP. It's not in acute gastritis. Ulcerative colitis, there is passage of blood and mucus, but patient is not having foul smelling stool. Clear? So guys, correct answer. It appears that most probably it's pseudomembranous colitis. Okay. Next, what is the management of patient presenting with constant chest pain with following radiological finding? Guys, what was the problem? The patient was having Burgess disease. What was the problem? There was constant chest pain. Guys, what was the problem? Anybody remembers this question? Anybody? Stanford type B. Okay. So it was related to aortic dissection, Stanford type B. Okay, aortic dissection, right? Stanford type B. So guys, here obviously we'll go for surgical management. There was one question related to solitary thyroid nodule. Tell me what was the question, guys? Solitary thyroid nodule. Gopal, what was the question? Okay, it was Stanford type B stable vitals next step. What was the question related to solitary thyroid nodule? Okay, solitary thyroid nodule, obviously next step, thyroid function test. So solitary thyroid nodule, next step is thyroid test. There was one question related to Nissen's fundoplication, image-based question. So it was Nissen's fundoplication, you know, that is 360-degree fundoplication. So it was Nissen's fundoplication, that is 360-degree fundoplication. And there was another question related to Graves' disease. Graves' disease. Anybody remembers what was the question? Question related to Graves' disease. Guys, what was the question? What was the question? Related to iodine 123. See, first investigation will be obviously what? Thyroid function test in solitary thyroid nodule, and investigation of choice is FNAC. The question related to Graves' disease, obviously there is increased T3, there is increased T4, there is increased TSH. Somebody was telling me that this was the option. Increased T3, T4, TSH. Initial investigation thyroid function test. Okay. Next question. Female presented. Okay, this was the question. 1 into 1 centimeter thyroid swelling. Next best step. We have to go for what? T3, T4, TSH. So it is thyroid function test. We have to go for T3, T4, TSH. T3, T4, TSH. Okay, next. 46-year-old male presented to OPD with chronic abdominal pain. X-ray abdomen was performed. What is the diagnosis? Guys, can you tell me what was this question? Chronic abdominal pain, X-ray abdomen was performed. Anybody remembers? Chronic abdominal pain, X-ray abdomen performed. What's the diagnosis? Graves' disease, it is associated HLA-B8-DR3. Okay, this was chronic pancreatitis calcification. Okay. So guys, it was chronic pancreatitis calcification. This was chronic pancreatitis calcification. Chronic pancreatitis calcification. Okay. Chain of flakes appearance was there, right? So obviously it is chronic pancreatitis. So there was chain of flakes appearance. Chain of flakes appearance. So obviously it is chronic pancreatitis. Clear? So it was chronic pancreatitis. Calcification around pancreas. So obviously it is chronic pancreatitis. Right. Next. Name the investigation performed. What was that investigation? Anybody remembers? Okay, monoclonal antibody wants to say that surgery was hardest in the evening shift. Name the investigation performed. Any other question, guys, you remember? Total penectomy with bilateral inguinal lymphadenopathy. Okay, there was total penectomy, right? Total penectomy with bilateral inguinal lymphadenopathy. Inguinal lymphadenopathy. Calcification, barium swallow film. Okay, it was barium swallow. So it was penectomy. Okay, it was barium swallow image. Barium swallow image after alkali ingestion. Alkali ingestion. Guys, Zenkus diverticulum was there. Zenkus diverticulum picture was there. Zenkus diverticulum. Zenkus diverticulum. Okay, nasojejunal tube. There was nasojejunal tube insertion. Nasojejunal tube insertion. Okay, testicular torsion was there. Yes, we discussed testicular torsion image. Any other question, guys? So, guys, if you remember, please send the images and the questions on this email ID. On this email ID, drpritesh@gmail.com. There, I'll be eagerly waiting for the questions. Okay, Romovac train was also there, right? So thank you, guys. Thank you very much for the participation. I will be eagerly waiting for your responses and the questions. Okay, good luck. Take some rest, relax, and good luck for the results. Okay, guys. Bye-bye.